Today, we're going to step outside the usual hospital walls. We're going to explore a totally different kind of nursing, one that cares for entire communities right where we all live, work, and go to school. So, quick question. When you picture a nurse, what's the first image that pops into your head? You're probably thinking of someone in scrubs, maybe in a busy ER or at a patient's bedside in a hospital. And look, you're not wrong, but that's only one part of the story. There's another side to nursing that works on a much, much bigger scale. Okay, here's the key difference right here. A hospital nurse zooms in on the individual patient in front of them. But a community health nurse, they zoom out. They're looking at an entire population. Their whole focus shifts from trying to cure sickness to actively preventing it in the first place, promoting wellness across a whole town or city.
To really get our heads around this, we need to make a pretty fundamental shift in how we think. We have to start seeing the entire community as a single, living, breathing patient.
It all starts with how we define health. The World Health Organization has this fantastic definition. It's not just, not having a cold or a broken bone. It's a state of complete physical, mental, and social well-being. It's the whole picture. And a community, well, that's more than just a place on a map, right? It's a group of people who are connected. They share common goals, they interact with each other. It could be a neighborhood, a school, or even an entire city. And this brings us to the most important idea of all, the real paradigm shift. The individual person is just one part of a much larger whole. The community itself, that becomes the primary client. The community is the patient that needs care.
So how in the world do you treat an entire community? I mean, you can't just write a prescription for a city. You need a completely different set of tools and strategies, a whole blueprint designed for wellness on a massive scale.
That's the big question, isn't it? If the community is your patient, how do you diagnose its problems? How do you check its vital signs? You can't just use a stethoscope on a neighborhood block. Instead, you look at what are called the broad determinants of health. Think of these as the vital signs of your community patient. We're talking about the underlying factors, things like income levels, education, access to clean water, strong social support. These are the things that really shape a community's well-being. And the whole approach is incredibly proactive. It operates on 3 distinct levels. First, you've got primary prevention, things like vaccination campaigns that stop a problem before it even starts. Then there's secondary prevention, like health screenings that catch diseases early on. And finally, you have tertiary prevention, which helps people manage long-term issues so they can maintain the best possible quality of life. But this isn't just about what nurses and other health workers do for a community. It's really about a whole philosophy of empowering the community to take charge of its own well-being.
This phrase is just so powerful. Health in the hands of the people. It was the theme of a huge landmark conference way back in 1978, and it perfectly captures the spirit of primary health care. The goal is to move from a system where people just rely on health workers to one where the community is self-reliant.
So, how do you put health in people's hands? Well, you start by providing 8 essential services, which are neatly summarized by the acronym ELEMENTS. This isn't just about treating sickness. It's about building the fundamental blocks of a truly healthy society, everything from education and immunizations to proper nutrition and safe water.
And to see how this all works in the real world, let's take a quick look at the Philippines, where this approach has a really long history. You can trace its evolution from these super early dispensaries all the way to a major turning point in 1991. That's when the local government code actually handed over health services to local units, bringing that care so much closer to the people.
So how are all these concepts actually structured in the real world? How do you take these ideas and use them to build healthy communities from the ground up?
Well, that move to local control created a really clear structure. You have the Department of Health setting the national policy, the big picture stuff, but it's the local government units that are actually delivering the services through rural health units and, at the most local level, barangay health stations, which are often the very first place a family goes for help.
And this brings us back to that core philosophical difference one last time. Standard primary care typically focuses on the individual and just the absence of disease. But primary health care, that's a whole different ballgame. It's about the entire community, and the goal is self-reliance, prevention, and overall development.
And that leads us to the ultimate goal of all of this. It's about so much more than just providing services. Community health nursing is, at its heart, about community organizing.
It's a process of educating, mobilizing, and empowering people to identify their own problems, find their own solutions, and truly, finally, take health into their own hands.
So as we finish up, I'll leave you with a question to mull over. Just look around your own community. What are the building blocks of its health? Is it the parks, the schools, the local services, the social connections? What makes your community a healthy place to live?